installment of our 2021 Mayday Workplace Mental Health webinar series. Today's webinar is titled Workplace Mental Health Resource Updates from OHCOW and Partners, and will include presentations by Valerie Wolf from OHCOW, Marnie Dobson from the Healthy Work Campaign, Daryl Stevenson from OHCOW, and finally Norma McCormick from Corporate Health Works. My name is Patricia Phillips. I'm a registered nurse and executive director here at OHCOW, and I'll be your moderator for today's session. It's my pleasure to introduce you to our presenters. First off, we have Valerie Wolf, who's executive director at OHCOW and has been here for several years and working diligently with John, who many of you have seen and heard speak before. She's been working with him with our workplace mental health. She's been part of our MIT group since being here, and so she will be presenting a page peek, as we call it, for our new website. And then we have Marnie Dobson, Director of Healthy Work Campaign, and Marnie is an assistant adjunct professor at the University of California, Irvine, Center for Occupational and Environmental Health, and the Associate Director of the Center for Social Epidemiology. She's also Director of the Healthy Work Campaign, a public health campaign sponsored by the Center for Social Epidemiology, a nonprofit center focused on raising awareness in the U.S. about the health impacts of work stress on working people and what can be done to change the organization of work. Third up, we'll have Daryl Stevenson, ergonomist at OHCOW. He'll be presenting Hearing the Voices, Benefits and Possibilities to Learn from Qualitative Tools and Analysis. Dr. Daryl Stevenson is an ergonomist at the Occupational Health Clinics for Ontario Workers in our Hamilton Clinic. And Daryl completed a PhD at Western University in Health and Rehabilitation Sciences and currently teaches research methods courses part-time at Western University. And then we have last will be Norma McCormick, convener of ISO TC 283 Working Group 2. She'll be providing the psychological health and safety at work, managing psychosocial risk. Norma McCormick is founder and principal of Corporate Health Works, Inc. She's a member of CSA's Public Safety Strategic Steering Committee and has participated on several CSA technical committees. At the international level, she chairs the Canadian Mirror Committees and leads the Canadian delegations to 2 ISO technical committees, TC 292, Security and Resilience, and PC 283 that developed ISO 45001, Occupational Health and Safety Management System. She served as convener of ISO TC 283, Working Group 2, which was responsible for ISO 45003, Psychological Health and Safety in the Workplace. For her volunteer contribution to CSA standards development, Norma received CSA's Award of Merit in June 2006. And so that rounds up our presenters, and we will turn it over then to Val, who will be starting with our OHCOW mental health webpage. Go ahead, Val. Thank you.
Thanks very much, Patricia. What I wanted to show everybody today is a sneak peek. We had hoped that we would have OHCOW's new website ready by this date when we planned it, but it isn't quite ready yet. So this is just a peek of what it's going to look like. By the end of the summer, it will be live, and we're adding a fair bit of workplace mental health content. And in fact, it's one of the main topic areas on the site. So I just wanted to share, I guess, and also seek ideas for resources. It's the idea of the site is to offer more information from the workplace perspective of things that workplaces and workers as a group or a collective can do to improve mental health in the workplace. So it's very much that. It's not an individual focus, it's the focus on groups and workplaces. So so this will just be, it's a bit of a tease. I apologize because that you can't just go and click on it and navigate your way through, but we will send an email to everyone who registered when it is ready. But we just want to share. It's been designed by Leslie Shime, who is a designer recently retired from CCOHS, who actually helped us with the Stress Assess website. And in fact, we won a prize. Her designs won a prize from Adobe at that time. So we'll have to talk to her about whether we think this one should be submitted as well. So basically, it's in the new kind of scrolling down format with tidbits of information. It's going to feature Mayday Mayday, which has become one of our main knowledge translation vehicles at the time in every May, but also the content lives on in the videos and the slides and the contacts that people can get in touch and that kind of thing. So that's a major feature, and especially this month, it may not always, all of these bands can move up and down depending on what's happening. We also have connections to other resources on our website. So this one links to some tips. Now this is more that we posted at the beginning of the pandemic, but they're still relevant today in terms of tips for workers and employers, stress prevention, that we actually borrowed from Safer Work Australia, who are listed later on in our partner section too. So just giving you a little tease. And then also, as we presented at the beginning, we've been doing work on pandemic experience and its impact, and linking over to the presentations and to the surveys themselves. Although I guess, John, I did not double check if they're still open.
Yes, they are.
Yes, they are. So anybody who hasn't filled one out who's still here, please go to our website. We can put the link in the chat to let us know how you're experiencing the pandemic now. It is possible to do more than one, because there's a way to code it, so you can go back and provide us with some updates, trying to include some stats so people understand the significant impact of work in people's mental health, all towards making a case for doing something about it. We also have links over to Stress Assess. Many of you on the call will be familiar with it. And it has, if we go over to the main Stress Assess page, I was just going to show you a little bit on how to navigate. I won't dwell on it, but it does have lots of information about the two different versions, the personal version and the workplace version. There's more information more information in general about the case for doing something about mental health in the workplace. And then if you click on the Getting Started, it will lead you through the navigation of the 5 steps to sort of go through, and also more of the more information on background information on why should you care, for instance, and reasons to do a survey and that kind of thing. So there's a lot of information on Stress Assess, but one of the main reasons we wanted to build this page on OHCOW, so to Stress Assess is a separate site that we built in partnership with CCOHS, but it's very focused on the survey, and particularly on staging the survey. And so we wanted to provide more content here, more resources that could support workplaces who aren't quite ready to do the survey, or who, having done the survey, are now looking for guidance, assistance, and just other resources that can help them work through their results and improve things at the other end. And to that end, some of you may have been here at one of the previous May Days. I think it was just last week that we shared the new guide. It's a smaller guide that we've created, which I'll show you in a minute, but included in there are a number of templates that are related to, which I have downloaded already, so I don't do it in real time here, but there's a template. These are all related to Stress Assess. Again, a template for planning and implementing the tool in terms of putting a committee together and creating a timeline and that kind of thing. And then there's a template for results and recommendations, and then recommendations, work planning and tracking tool. I can show you that one, which sort of, having received the report, and your, sort of the top recommendations that come from, I guess I may be doing the wrong order, because you have to kind of translate the results into what it means to the workplace, and then generate some recommendations for the organization. In this case, this is modeled after a joint health and safety committee doing that, but it could be a specific committee, a wellness committee, or a specific committee around workplace mental health, developing some recommendations and an actual action plan with some dates and goals, and then commentary that would be able to check in. Here's the template that we shared. Ooh, I did the wrong thing. I downloaded it again instead of opening it. That's a way to take all the information that you get from the stress assess report and make it into sort of the key factors, and then some background in your organization, and then results. So that's a set of tools already on the site that we want to have more people able to use. And we're also have started to include information on the survey that we ran in 2019, which is a national survey that is actually the basis of comparison of stress assess. So we have never actually, although John has presented it a few times and it's been in a slide deck on our website as a resource, now we're trying to curate it in a way that people can learn more from right away, in terms of, sort of nationally across Canada, this is how workplaces experience workplace mental health, to give a sense of how that might compare in their own. So the different categories are here, and the charts related to that from in 2019. So job security was good, and the organizations have generally enough resources, generally staffing. It would be interesting. We are having done it in 2016 and 2019, we would hope to potentially do it again in 2022. So that it's something, but finances permitting, basically. But it's quite useful to look at the national data over time. So this will all be available to everyone to scan through. And this is the major part of the site, is trying to create a workplace mental health toolkit that includes information on the various factors that our survey covers, and that are included when people get a report, more information that can be used as a resource. Right now, we only have populated it with the ideas for action that we actually come with the stress assess report when it's when people receive it. But we've started to add some of the relevant ILO checkpoints, because we have found those actually ourselves at OHCOW as a good discussion point for committees, and ways to find solutions or strategies that could maybe work for them. So right now that document exists at the ILO in one, it's an app or it's a whole PDF. It's not broken down into individual topics that are clickable. So that's something we're hoping to make it more accessible and directly relevant to to each of the resource or categories in the tool. So this is ambitious. We've realized when there's so many different subjects to cover, and we've also realized lately, and we'll think about that more through this whole presentation, is that nomenclature, different countries or different programs call the same concept something different. So how we curate information in a way that's accessible will be and understandable will be an ongoing work related to this. And we've got some quotes here, which are actually taken from last week. So we've moved pretty fast on this website in terms of adding the impact that using stress assess and the mental injury toolkit has had for people. The mental injury toolkit is a resource that's been on OHCOW's website for many years as a document, but now we have it broken down by chapter with additional resources and that kind of thing. So also hoping to make it more accessible, and eventually to do an updated version. And then any of you who attended 3 weeks ago, I think, is when we presented this new guide, which we have been calling the Mini-MIT. it is already available on our website as a downloadable PDF on the Mayday page, actually, but it will also be available on the website as well, so people can capture content out of it in that way. So I think that's, I'm not sure if there's anything else to show you. Oh, and as you know, we have a number of videos from the past. You see John's face and Terry's face that we will also be curating and have people able to watch it right here when you're on the page, or go to the YouTube channel and see a set of resources related to workplace mental health there. So that's kind of my sneak peek. We're very excited about it. Hopefully it makes more information more accessible to workplaces so they can jointly solve problems and communicate about workplace mental health. Thanks very much.
Great, thank you very much, Val. So we're going to open the floor now for some questions. I don't see any having come up in the chat box at this point, but I'm also looking to have some feedback too. If there are things that people would like to see or have some thoughts on in regards to our website as we're building it, we'd be happy to take those suggestions. It's ambitious, as Val is saying, a very ambitious project, and we're definitely excited about being able to get this up on our website once it's up and ready to go. So a lot of good information, you know, and Val was mentioning how we're focusing on the prevention at the primary level, at the organization, rather than at the individual. And so finding that and working with that information, there's not a lot out there yet. So we're doing what we can to pull that together as well. So, but any suggestions or any questions, please feel free to open your mic. We'll give it a minute.
I did forget to mention that we have contacted some researchers over the past year to get their research teams to look for some evidence-based content that we can use to expand on some of the mental injury toolkit, workplace mental health toolkit topics. So we will have, and we've already got some content for 6 of them, so that will be added as well. And I just scanned to this, the partners et al. So we also welcome other ideas or links that we can go to. We've got the Healthy Work campaign and People at Work, which we mentioned, where we had used some content on our mental health at work page, the COPSOC, of course. But of course, ISO 45003, there'll be potentially, and the CSA we don't have here right now. So this is in progress. So ideas of other places to link and or specific content, if it's relevant to workplaces, would be most welcome.
Thanks, Val. We do have a question here from Marnie. Beautiful website and a lot of great material. Plans for distributing it to workplaces. Do you track organizations' use of the website?
It's a really good question. And we do some analytics, but that is something that we definitely need to improve on, I think, in terms of coding the site for ability to get the analytics and then to reflect on them and to do targeted marketing. Definitely marketing and promotion is something that will be part of the planning once we have the whole site up, and then it's specific targeting for these program buckets. We call them, very technical term, but for our programs, I think is a really good idea. And I'd be interested so I can ask you that same question, Marnie, when after your talk, in terms of what you found to be accessible or to be successful in reach and impact and engagement. So that would be quite interesting. Thanks.
All right, great. Thanks very much, Val.
Thank you for everybody.